昨天，国务院联防联控机制综合组发布了进一步优化新冠肺炎防控工作的20条措施。20条优化措施是对第9版防控方案的完善，不是放松，而是放开。
We will optimize the version 9 guideline. We are not getting loose those containment measures. Instead, this optimization aims at precision and scientific level. We aim at the maximization of people's safety and the influence over our economy. We will unswervingly commit ourselves to people-orientedness and putting people's life first, and we will continue to avoid the transmission of the pandemic, and we will observe the dynamic zero-COVID policy. Science, precision, prevention, and early discovery will be our principles as well. We will try to curb the scaled-up rebound of the virus. We will do our best to guarantee people's life necessities so that in the pandemic era, the basic life and people's medical needs could be met. The real difficulties faced by the common people must be in our minds. We cannot take a one-size-fits-all policy, and we cannot exaggerate those containment measures in practices. So today the topic is the optimization of the containment measures in an effort to properly handle the pandemic prevention and control. We have invited Mr. Lei Haichao from the National Health Commission, from the CDC, Mr. Chang Jile, from the Ministry of Transportation, Deputy Director General Han Jinghua, from the Ministry of Commerce, Consumption Facilitation, Director General An Baojun, from the CDC, Research Fellow, Madam Wang Liping. Our experts will take your questions. Now the floor is open to questions and answers, and please identify yourself before raising the questions. From CMG, this optimization of containment measures may have some considerations behind it. So what are those considerations? Why do we stress that optimization doesn't equalize release of the measures? Will this lead to higher risks of transmission? Will this pandemic still within our control? Mr. Lei Haichao. Thank you for that question. Speaking of the optimization of containment measures, it's based on our past 2 years of experience. Readjustment is our working style. The continuous optimization of containment measures doesn't equalize with loosening those measures. Instead, it more emphasizes scientific and precise containment, and we must also keep up with the times. For example, we must keep up with the trend of the variation of viruses and our capability of containment. After all, we have accumulated some clinical experience and knowledge about treatment, so we have reasons to optimize and readjust our containment measures. In general, we urge to stabilize our economy, contain the pandemic, and develop safely so that we can strike a balance between the pandemic prevention and control and minimization of economic and social influence, as well as people's basic life needs. Since the COVID-19 broke out, we have followed closely the trend of the pandemic globally, as well as the variation of viruses. In combination with the effects of our containment measures, we dynamically readjust and reevaluate our containment measures. A batch of experts have been studying, and with 2 years of practices, we have undergone several rounds of severe challenges posed by the rebounded viruses. As to the rules of transmission and the clinical features, we have acquired some new knowledge. Besides, as to R&D of vaccination and medications, we also have made some progress. Therefore, we must respond to the new situations and take customized efforts in response. We must improve the level of science and precision in our containment measures. It is fair to say that every optimization of containment measures is very prudent, and it has been verified by experts so as to ensure the controllable risks. And considering that China has a big population, especially the large number of vulnerable populations, such as the elderly people. Now, elderly people take up a large proportion of the total population in China. Those are the basic features in China. Besides, our medical resources are not in big absolute number, and across regions between urban and rural areas, those resources are not distributed in an evenly manner. So based on the version 9 guideline, we've done a new round of studies and evaluation. They came to the final 20 policy measures to optimize. The optimized measures will be effectively helpful to break the bottlenecks faced by a variety of places. For example, when the places are confronted with a very limited supply of isolation rooms and resources and the huge pressure on the epidemiology experts, for example, now for the close contacts of the close contacts, we don't need to do the traveling history review of those people. In that way, we could concentrate on the close contacts. For the risky places and the close contacts, the survey of their traveling history and risky levels will be the priorities of our professionals. So within the limited time, we could take the minimized cost to balance between the containment measures and economic and social development. So our optimization is based on our scientific knowledge and also the evidence-based research plan. So it's not loosening the measures. It's not equalizing with giving up containment. Instead, we are trying to adopt more scientific and prudent measures. Thank you. From Xinhua News Agency. In the new 20 measures, they have drawn wide attention from the public. Could you give us more detailed interpretation about the highlights of this optimization? Mr. Chang Jile. Thank you for your question. Indeed, you made the point. Since we publicized the 20 optimization measures yesterday, we have received wide attention from the society, and we have noticed that people's attention to the 20 measures might be biased or might not be thorough enough. People wonder the reasons behind and the logic behind those optimizations. So allow me to introduce the reasons. For example, speaking of the management methods of those close contacts, previously it was 7+3 isolation was changed to 5+3 isolation policy. As you may have noticed, in version 9 guideline, which was published on June the 28th, 2022, Yet, this plan already came out in January this year. On January the 8th, Omicron was confirmed to enter the Chinese borders. So, in January, we made out this new policy. Then in March, it came into initial being. And in the next 1 month, before May the 5th, in 7 cities nationwide, we have piloted the version 9 guideline. And as to the outcomes of the pilot implementation of guideline number 9, we concluded it was BA.1 and BA.2 that were the dominant viruses prevalent in China. And we noticed that the positive infected people after being exposed to the virus the possibility of being cured after the isolation days became 97.3% after 7 days of isolation. So that's why we decided on the 7+3 policy of isolation. In July and August, we did a re-evaluation of this plan. And the most prevalent virus was Omicron BA.5, 0.52, and 2.7.6. With our re-evaluation, we discovered that within 3 days, the curability was 81.4% and 90.1% and 94.5% and 99.7% respectively after the 3rd day, 5th day, and 7th day of isolation. That's why we decided to optimize the isolation policy to be 5+3. So from guideline version 1 to guideline version 9 and the optimized version, we have undergone huge differences from the 14 days of isolation to 7+7+ and to 7+3 and now to 5+3. That's the process of evolvement. It feels like 5+3 days of isolation are 2 days less than the previous policy. It's only 2 days difference, but it can save 30% of isolation resources. Since we have a big population, the cut of 30% resource consumption is a big thing for China. So why 5+3? With our testing, be it Omicron BA.5 or BA.2.75, 2.76, they have very similar probation days, about 8 days. The next concern of the public is about the canceling of identification of the close contacts. We also have our evaluation theories behind it. We discovered that the close contacts infection rate is very low. It's about 3.1 per 100,000. With immediate identification and control of the close contacts, we can greatly reduce the infection rate of the close contact. That is to say, we have means to reduce the infection rate. That's why we decided not to control the traveling of the close contacts, then we can better optimize the resources and services. You might be wondering, with the ratio of 3.1 per 100,000, and if we multiply that ratio by a large number, the absolute number is still shouldn't be underestimated. But I have to say, we have public policies to control them. Public policies will need to strike a balance. That's why we opted towards the resource distribution this time. I have to say that the risk is controllable. The next big highlight is about the identification of the risky places. We have, for example, contained, controlled, and managed areas before. Then in guideline version 8, we have highly risky, intermediate risky, and low risky places. In version 9, it's the same. Why? Because for the contained, controlled, and managed places, they are very hard to understand for the common people, at least harder than the classification between high, intermediate, and low risks. After some months practices and re-evaluation in the summertime this year, we discovered that for the intermediate risky places, the cancellation ratio of the positive cases was 3 per 100,000. So that ratio is not very high. Meanwhile, if we set up the intermediate risky levels, we will have to control more people. That's going to be a huge burden on our medics. So we reconsidered and decided on canceling the intermediate risky places. To give you another example, as to the people from the high risky places, they used to be controlled with 7 days of centralized isolation, but now they can have a stay-at-home isolation for 7 days. So in that way, of course, the risk is pretty high. The risk is about 4.9 per 100,000. But after coming out of the original places, within 7 days' time upon arrival in this destination, their positive results could be tested out. Of course, we know that the high-risky places will generate high risks. This traveler may take airplanes or trains or buy his personal cars that may have some risks towards the other people. So if without a timely control or publication of the information, then there will be higher risks. So for the people coming out of the highly risky places, we maintain the 7 days isolation, but they don't have to be isolated in the designated places. Instead, they are isolated in their communities. That's easy to handle. Another concern is about high-risky personnel in the closed loop. They used to be isolated for 7 days, but now it's only required to have 5 days of stay-at-home observation. Of course, that changes based on our observation and re-evaluation. Those highly risky personnel working in the closed loop, as long as they strictly observe those closed loop management rules, their infection ratio is very low. It's 1.6 per 100,000. That's much lower than even the infection rate of the intermediate risky places. It's less than half of the former. That's why we decided to readjust the requirement of those risky population working in closed loops. It's only 5 days of stay-at-home observation. They can take the nucleic acid tests at their own homes for 5 days in a row. So that's my answer and interpretation of the optimized measures. For every optimization measure, we have reasons and grounds. You may feel like those optimized measures sound like we're taking looser measures. Instead, we have higher requirements. For example, for the contacts of close contacts, the infection ratio is 3.1 per 100,000. And for the infection rate of personnel working in the closed loop, the ratio is still at around 1.6 per 100,000. That urges us to take more quicker and standardized measures to control the risks. To keep everything under control and implement all the necessary measures and cancel the unnecessary ones, we must make the most of available resources to improve efficiency of our containment and coordinate between pandemic control and economic and social development. Thank you. From China Transportation News. Recently, it has been heatedly discussed that the truck drivers have faced a lot of limitations and their rights have been infringed upon. And it has been proposed that we should try to crack down upon such unnecessary stringent measures on certain population. So how is the effect? Thank you for the questions. In some places, we have witnessed the phenomenon of over-control of the truck drivers, leading to the logistics problems, dealing heavy blows to people's normal lives and production. We pay high attention to that issue, and we also put this job on the General Office of the State Council's Logistics Bureau. And for the affected province, we will urge them to report as a matter of fact to us to ensure the logistics development. Next step, we will implement the spirits in the conference held on November the 10th. We will give first priority to people's safety and continue to adhere to the principle of averting the transmission of the virus from elsewhere and outward. We will try to avoid the one-size-fits-all policy and the over practices and implementation of the containment measures so as to minimize the impact of this pandemic over our economy. We will do our best to give sufficient transportation support. First of all, coordination. We will clarify the control measures and implement the State Council's newest 20 measures of optimization. We will urge the places to implement those precise measures. We will forbid the willful close down of transportation facilities and limitation of traveling. We will forbid taking the registered places as the reference to limit the traveling of the trucks. We will forbid any one-size-fits-all policy, especially the terminal transportation. We will try to solve the last 1 meter problem of transportation. For the closed down cities, we will forbid the inlet and outlet of those trucks while making necessary measures to guarantee the basic needs. We forbid waiting for the nucleic acid testing results while forbidding the trucks' transportation. And secondly, we urge the responsible authority to be responsible. In some places, there are willful close down of logistics and transportation facilities, cutting off the transportation line and limiting the traveling of trucks. Those belong to the over-control, and we will urge the special team to be in place to correct the behaviors locally. For the repeated wrongdoings and untimely response, we will expose their wrongdoings in order to put pressure on them. We will try to avoid the over-implementation of containment measures and smooth away the logistics services. And fourth, one-stop services. There will be 24/7 services on post, and we have a hotline to guarantee smooth transportation. Once we receive a phone call about the complaints, we will handle it immediately, and there will be dynamic monitoring, and there will be a closed loop to improve the timeliness. For the key resources, we must ensure their safe transportation. For the complained transportation and logistics issues, we must do our studies and try to locate the conflicts in order to come up with relevant response measures. I have to give you some reminders. First of all, for the truck drivers, please pay attention to the destination's containment measures and adhere to those requirements. Secondly, in your transportation process, if you have faced up to such unsmooth transportation issues, please call our office hotline. And we have 24/7 services, 010-6529-2831. That's our hotline. We will try to help you solve that problem individually. Thank you. Next question.
谢谢主持人。光明日报社记者提问：优化防控工作20条措施公布以后，
From Guangming Daily. In the 20 optimized policies, the society is highly concerned with it. What measures will be taken to urge the localities to implement them accordingly so that they will not loosen their implementation and not over-implement them? Thank you for the questions. Optimizing and formulating policies are important stages of our daily work. But more importantly, for the optimized policies, we must ensure their full implementation. So, in the future, we will take some management measures to encourage the effective implementation of the 20 optimized policies. In the prevention plan and the treatment plan of version 9 guideline, we have been observing this policy and principle. First of all, we will urge the party cages to properly interpret these measures. Yesterday afternoon, the State Council Joint Prevention and Control Mechanism convened a teleconference. Vice Premier Sun Chunlan shared some details about interpretation of the 20 optimized measures. And for those responsible authorities and departments, there are certain requirements as well. The cages must take the lead to interpret the new policies. That's the first step for implementing the new measures. 2 days ago, the Standing Committee of the Political Bureau reviewed the preliminary work relevant to the 20 optimized measures. And we will also enhance the training of personnel. Even though the 20 readjustments are not a big amount, in some places will have to optimize their measures accordingly. China is big in size, and there are several levels of administrative regions. And since we take joint prevention and control measures, our measures must look at the big picture as well. That requires all levels of personnel working in the front line to fully understand and grasp the 20 optimized measures. This afternoon, the CDC has already arranged certain training sessions. At national level, we are working around the clock to execute the proper implementation of the 20 optimized measures so that everyone could get to the essence of the new measures and implement them to the full. And in addition, we will need to educate the common people so that everyone is in the know of the optimized policies and learn the basics of the contents. Only when the general public is involved in our containment efforts can we gather enough support for the long run. Besides, once the general public learns the new policies, they can better monitor the execution of the 20 new policies. And that will be a virtuous cycle. Fourthly, we will need to reinforce our handling of the one-size-fits-all policies and over-implementation issue. Localities have already put in place the steering committee to handle that issue. Every day, we keep our interaction with the localities across regions for all sorts of problems encountered by the general public. We are responding to their complaints. We refer some of those problems to the local authority for better handling. In the future, to implement the 20 optimized measures, we also need to collect the feedback from the general public and organize those comments timely. We will also refer those complaints to the media friends so that those 20 optimized measures could be implemented with no discount. As to our treatment of the one-size-fits-all policy and the over-implementation, we will organize our experience for better interaction and communication. There may be some typical cases to be shared. We will expose those cases to the public. Now, I sincerely call upon our media groups to continue to pay attention to this effort, especially in terms of formalism and bureaucracy. Let's make joint forces built on our consensus to promote scientific implementation of our containment measures so that we can strike a balance between pandemic containment and people's livelihood as well as economic and social development. Next question.
From
CMG, CGTN. In the optimized measures for the inbounded personnel, there are some new policies about their control. So what is the logic behind the optimization? Madam Wang, thank you for the question. In line with the updates of the pandemic and new features of the variants, and to better balance the international cooperation and exchange and the curbing of imported cases, we did our re-evaluation of version 9 guideline. On the basis of curbing the imported cases, we optimize the nucleic acid testing results of the people. First of all, as to the boarding at the gates, they don't need the 2 nucleic acid test negative results within the past 48 hours. The travelers only need 1 test result. Secondly, the infection rate is very high. So after getting in the Chinese borders, the first-time nucleic acid test positive results may have a CT value of over 35, and those group of people usually have a higher ratio of infections previously. And third, based on our pandemic control experience in the Olympic Games, for the business people coming in the Chinese borders, as well as those athletes and the sports delegations, there will be the closed loops for management. They must take personal measures and take nucleic acids. Fourth, based on the new variant, features such as shorter incubation period, and to avoid the cross-infection, we readjust the centralized quarantine to 5+3. That's the 4 changes based on the inbound travelers. Next question. From People's Daily. In the optimized measures, it mentions that we must have enough storage of the basic necessities to guarantee people's life necessity supply. In that regard, what are the detailed measures to ensure the supply? Mr. An Baojun. Thank you for your question. The Ministry of Commerce will strictly implement the spirits of the Standing Committee and execute the arrangements of the Joint Prevention and Control Mechanism to ensure people's basic life necessity supply. First of all, we will continue to optimize our working mechanism. The Ministry of Commerce will continue to enhance market monitoring and early alerts to deliver enough supplies in an early manner, and we will try to distribute with a smooth transportation to ensure the stable supply in the market. And we will set up a special team in the market who will be responsible for the emergency supply guarantee and pandemic control. For grains, flour, oil, meat, eggs, and vegetables, and other necessary food, we will ensure their supplies. We will also organize the cages from the commercial bureaus to connect with the keepers of those supplies to ensure the timely supply. And across regions, there will be joint supply and guarantee measures. We will smooth away the communication method in order to listen to the needs of the general public. Secondly, we must keep orderly operation of the suppliers. In the big supermarkets, the agriculture, food, wholesale markets, and some key supply places, we will ask them to implement the scientific and precise containment measures. As to the possible infections, they must be fully prepared beforehand. They must have contingency plans. For example, the backup markets. Once a case broke out, the vehicles, materials, and personnel could be transported to the new backup place immediately, and the supplies will not be undermined. Third, the guarantee of logistics. We guide different localities to set up a wide listing of suppliers. We will give top priorities to the operation of enterprises, the vehicles transportation, and the working of the first-line workers. We will also create favorable conditions for the workers elsewhere. In the risky places, we will set up some transfer places and gather more manpower over there. As to the vulnerable population, we will also set up certain guarantee measures so that in the isolation days, their basic necessities will be supplied. Fourth, a cross-region supply guarantee based on the local needs. The Ministry of Commerce will jointly coordinate the cross-region supply. We will organize the sources of the supplies to ensure sufficient supply across regions, especially when it comes to the life necessities as meat and vegetables. There will be timely and designated delivery of those supplies to add up the market supplies. We ask the localities to fully understand the main channels of those supplies and interact with the surrounding main production areas so that they could cooperate with each other once one party comes to difficulties. Once needed, such emergency help will come to the other party. Thank you. Next question.
谢谢凤凰卫视记者提问，想问一下关于当前的疫情，请问一下
From
目
the
前
Phoenix
内地
TV,
的疫情防控的重点和难点是哪些
for
方面？
now,
实施了20条的
what is the
优化措施之后
priority and difficulty of the containment in China?
措施尽
If
快
we
地去
implement the 20
遏制疫情蔓延
optimized
的开始
measures,
谢谢
what other tough measures will be taken to
王丽萍女士
curb
来回答这个
the transmission of the virus in the short run? Madam Wang Liping.
当前啊，国际
Thank
疫
you for
情
the
形势
questions.
错综复杂。那么对于这个
Right now, the
防控的
international
重点啊
pandemic
仍然还是
is still
人口密度
complex.
比较大哈，人口
So
集
as to
中
the
的这种大城
priority
市的
of
情况
our
那难点
containment,
实
it's
际上
certainly those
就是
big
我们这些措施
metropolises
怎么
with
样
higher density
落
of
实到好，
population.
把我们的各
As
项
to
的防控措
difficulty,
施能够做细做实
That
落实
lies
到位
in。how
那么
to
这是重点和
implement
难点。
those measures
那么对于
to the
怎么
full.
样坚决果断控制些疫情，那几个方
As
面，
to
第一个
what
首
tough
先是
measures
要
will be taken
这
to
个做好
curb the
这个
transmission,
常态化的监测
there
和
are
预
several
警，
ways.
然后
First of
提
all,
升我们整个新冠
we
疫
will
情监测
continue
的
the
敏感
regular
度，
monitoring
要
and
进一步落
alerts
实好四早，
to
加强
improve the
对于
sensitivity
这个
of
风险岗位从业人
our
员我们医疗机构
discovery
等等这样一些重点机构
for
和
the
重点人
risky
群的这个
population
监测。
working in the
那么
front
切
line,
实做
such
到
as
这
the
个风
medical
险人员
institutions
的
and the
早发
medics
现和
personnel.
管控，这是从监测预警角度。
We must have
那么
early
二是就
discovery
是
and
一
control
旦
of them.
发生本土疫情以后，
Secondly,
那么措施要果
once
断。
there is one
快速
local
完
case
善
found,
这个
our
当地的
response
这个应
measures
急处
must
置的
be
体系。
quick
那么对于
and
特大城市和重点城市要
help
更
to
加的
improve
突
the
出
local
精细、
response
精
team.
准、
For the
高
big
效，结合
metropolises
当地的实
and
际
key
情
cities,
形。
we must
情
take
况要加
precise
强
and efficient
这个防
measures
控指
in
挥
line
体
with
系
the
的这
local
个建设、细
conditions.
化操作的流程，做到分工明确。
We must
责
have
任清
our
晰
prevention
高
and
效
control
定准
command
那么
system
就是这
and
样
have a
的话
clear
就能
division
够
of labor
发现的早，
so
处
that
置的快，
the
那么
operational
就能
system
以最
could
小
be
的成本
efficient.
实现这个
With
控
early
制
discovery,
疫
we
情的
can
这样
respond
一个
earlier.
效果。
Then we can
那
minimize
当
the
然做到
cost
以上
to
的难点，那么
contain
第三点
the
非常的重要，就是
transmission.
要做好
Of
整个的
course, to
储备
accomplish the
准备
first
各项的准备
two
哈，我们第六版的
tasks,
防
the
控方案
third
以及
one
国内
matters,
联邦
that
控
is
控机制组也
the
先后印发了文件，
preparation.
要求各地要做好核酸检测力
The
量、
joint prevention
流
and
调
control
力量、
mechanism
隔
has
离资
published a
源，
certain
以及对于
document
流动人口
requiring the
管理的系统
localities to
支撑
have
哈，
enough
这个只
preparation
有
in
准备
terms
才能
of
做
the
到应
isolation
对所以
resources,
做好
the
与城市规
testing
模相
personnel,
匹
and
配的
so
医疗
on.
救治
Only
能力
with
的储
full
备，这
preparation
些都有
can
相应
we
的这个文
divert
件
all
的
the
这个要求。
risks. And
那
we
最
are
后一个方面呢，就
also
是要
aiming at
持续
better
地打造
capacity
强
building.
大的
Last
社
but
区
not
治理
least,
防线，
we must
将那
continuously
个城市治理
create
的
a
工作
very
重
strong
心
firewall
下移
at
到
the
城市
community
的社
level.
区。
So the
提前掌握
priorities of
病
the
源
city
区域的
governance
党
must be
员及
decentralized
事业
to the
单位干
neighborhood
部这
committees.
样的一些
We
力
will
量，要
mobilize the
提前的做好
local
这个疫情防控的专业的
party
培训
members,
和应对
cages
演
in
练，
the
这样真正要发生疫情
entities,
以后，
and
动用
there
动
must
用
be
我们这些
rehearsals
力量能够
and
更好、更快、更
exercises
高
for
效
those
地处
people.
置防
Then
控
we
做好疫
can
情的
more
防控。
quickly
好，
mobilize
谢谢。
those personnel to
好，谢谢。
respond
请
to
继续提
the
问。
viruses.
好，来
Thank you.
请左侧区第一排
Next
过
question.
道第一位记者。
好，谢谢秘司长。中央广播电视总台央广记者提问：我们在这个优化疫情防控的20条当中还看
From
到，它其
CMG,
中提到呢说要加强对
in the
隔离
20
风控人员
optimized
的
measures,
自
we
我保
also
障，并
noticed
且呢还
that
提到说要对这个
for
要
the
求要守诊，
isolated
坚持守诊负责
risky
制
people,
和这
there
个
must be guarantee
和这个危急重
and
症的抢救
there
治，
will be
并且
the
呢不为任何
accountability
理由来
system for
推
the
诿和忌
first
诊。那么我想请
treatment
问国家卫生
and
健康
for
委，我们
severe
将采取哪一些
diseases,
措
we
施来
must
具体
also
落
have
实
certain
上述
medical
的要求？
treatment plans
特别
in
是对于
place.
隔离风控的人员，
And
他们的
what
正常
measures
就
will
医
be
应该
taken to
如何保
implement
障？
that
谢谢。
requirement, especially
好，
for those
请
isolated
雷海
people?
潮
How
先
to
生来回答这
guarantee
个问题。
their basic
好，谢谢
need
您
to
的
medical
这个提问。
treatment? Mr. Lei Haichao.
生命至
Thank you
上，
for the
人民至
questions.
上。
这是我们党的执政理念。
Life comes first,
这个
and
执政
people
理
come
念
first.
不仅仅
Those are the
是要贯
governing
穿在我们
principles of the
疫情防控
CPC.
的
Those principles are not
也要体
only
现在我们日
enshrined
常
in
诊疗服务
our
的
practices
各
of
个环节的组织
containment,
当中。
but also
所以一方面我
reflected
们
in
疫
every
情要把它
stage
防
of
住，
our medical
但是老百姓日常的诊
treatment.
疗需
So
要，
for one
我
thing,
们
we
也
must
要
prevent
给予
the
相应的安排，
transmission. For
做
another,
出
the
积极的
basic
回应，
treatment needs
不能
of
够
the
因
general
为疫
public
情防
must
控
be
这一
met
方的理由，
and
就
responded.
推诿，就拒收我们有看病就诊需要的这些患者。
The medical needs
我想对
of
刚才您提到的
the
这个问题啊，
patients
可以区分
must
这么几
not
类情况
be
来进行相应的安排。
undermined
那么一类情况呢，就是
just
已经
because of
发
the
生疫
pandemic
情的
prevention and
这些
control
地
need.
方，比如说小区啊，
First of all,
或者是村庄
for
村
those
村
risky
庄啊，
places like
也就是有高风险的
communities or
这个疫情的
villages
这些
with
地方，
positive cases,
那么一定要建立在应急处置状态下的
we
医
must
疗服务
establish
运行的相应的
the
安排机制。
medical service
也就是说，我
operational
们要了
mechanism
解在高风
in
险地区
the
的这些
urgency
居民有
period.
哪些
We
特
must
殊的
know
就医需求，
the civilians
比如
living
说
in the highly
有哪
risky
些
places.
高龄的老人，
For example,
有哪些
learn
人
their
是合
medical
并的
needs,
基础性的疾病，
what are the
小区当中、
elderly
村庄
people
当中
and
有没
who
有
have suffered from
这个
underlying
孕产妇
diseases in the villages and
有没有
communities.
一
Are
些
there
需要
any
进
pregnant
行
women?
持续照
Are
料的
there
透析的
any
这种患者？我们要做到
need of
心中有数，
dialysis or
在了解底数的
continuous
情况下
care?
要
We
及
must
时
be in the
对他
know.
们在疫情处置
And
过
then
程当中的就诊要做出相
When
应
we
的
are
安排。
handling the
其实在
pandemic,
这方面呢，我
their
们也积累了
treatment
一些经验。
needs must
比
be
如说
met.
在已经发生疫情的
We
这些
have
地方，
accumulated some experience as to that. For example, in the affected
也
places,
就是说对
we
一些风
can
险人员，
try
那么
to
去就诊，
designate
要有相应的
some
保障
yellow
和渠道。
hospitals
那么
for
各
the
地呢
risky
也积累了一
population.
些这个经验和做法。关键就是我们要真正
Some
的
localities
落到
have
实处。
such practices, but the key
那么另外对这
is to
些
implement them to the
我们
full.
叫做健康的敏感人群，
In
要
addition,
建立台账式的管理，
those
对他们的需求
vulnerable
呢
people,
这个要随时做出响
sorry,
应，
those
特
people
别是看
who
病
keep
就诊
an
方
eye
面，
on
要有绿
those
色的
medical
通道，
needs must have a
既能够
log.
让他们第一时
Especially,
间
there must
到医
be
疗机
a
构
green
去看
channel
病就
for
诊，
those
也
people
能够在
coming
完
to the
成医
medical
疗处置之后
institutions.
顺利的返回社区。
After the medical
那么
treatment,
这就是
those
这
people
个
must
第一方面。
also be
第二
transported
方
to
面
their
呢，我想就
communities
是要更
safely.
加科学精准的
Second
做
of
好
all,
医疗机构的本身疫
to
情
more
防控的工作。
scientifically and precisely
因为我们的医疗机构啊，
prevent
就是
and
接诊
control
患
the
者。
pandemic in the medical
在发生疫情这
institutions.
个地方呢，
The
也
medical
难免
institutions
会有阳性的
are
感染人员
required
到
to
医疗机构
receive
去
the
就诊。
patients.
那
It
么
is
一旦
inevitable
有
that
这
there
个
might be positive
具有
and
感染风
infected
险的人
people
员去就
coming
诊，
to the institutions for
这样的
medical
环境
help.
是有可能会产生风险的。
In such a
那么因
risky
此，
environment,
也需要采取一些必要的措施，对于
we
患者到访的
require
环境。
some
进行
necessary
综合的消
measures in place
但是我们说啊，对医疗
so
机
that
构
there will
发生这
be
样的情况以
terminal
后
disinfection
不
in
能
that
够简单
environment.
的一封了之。
Once a medical institution has
我们还
encountered
是要讲究科学
that
精准，
risk,
要进行
they
风险
cannot
的
just
研判和
be
评估。
closed down.
那么一旦
Instead, we must
做完了
reevaluate
通
the
过消
risk
杀，评估这些风险已经得到了
with the
有效的
terminal
管控，
disinfection.
应该在第一时间
If we evaluate that all the risks are well under
日常
control,
诊疗秩序，
we must resume
不能
the
够说因
operation
为有
of
阳
those
性感染
medical
者到访
institutions
就持续关
immediately.
闭，就关闭很多的科室，关闭很长的时间。
The
这样的话
positive
往
case
往就会影响到
disposal
其
must
他患者
not
的看
be
病就诊
handled
的
at
机
the
会
expense
和服务
of
安
the
排
normal
问题。
operation of the medical
这是第
institutions,
二个
because
方面。
that is
第
gonna
三个方面呢，
undermine
我觉得就是要
the
对一些重点
medical
人群
needs
要做出
satisfaction
更
of
加
the
精
other
细的
patients.
这个安排。
Third, for the
我
prioritized
们讲
population,
要
we must have
这
more
在常态
detailed
化的这种
policies.
防控情况下，要把我们的服务工作
Under the
做得更
circumstance
细，
of regular
更加具
pandemic
体。
control,
这就要求
our
我们对
services
于
must
辖区
come to
内
more
的刚才我
differentiated
提到的一
levels.
些
That means within our jurisdiction, those people, especially elderly people suffering from underlying diseases, the pregnant women, and patients in need of chemotherapy or dialysis must be able to access medical resources based on our knowledge of them. Some may have like diabetes, hypertension, and other chronic diseases. Their daily medication needs must be met because they need to live on the medications. Their medications couldn't be cut off just because of the pandemic. Then, patients with chronic diseases can have reasonable arrangement, and medical services to these groups of patients can be timely delivered. Fourthly, we must replenish our team of medics. In some localities, with the outbreak of the pandemic, the need of ICU patients haven't been met. Those cases are heart-wrenching. We hope that such phenomenon could be avoided in the future. In terms of ICU services, even against the backdrop of pandemic outbreak, must be ensured with sufficient medics and sufficient vehicles. We must be able to dispatch ambulances once needed. Even with the pandemic plaguing the city, we cannot overemphasize the importance of zero risk. People's life comes first, even during the pandemic time. So for the ICU medical needs, they must be ensured. That's why we must be fully prepared with sufficient resources. Fifthly, in the centralized quarantine places, with the optimized 20 measures, the close contacts will be the key risky population in our centralized isolation stations. But as to the contacts of those close contacts, they will not be designated as close contacts anymore. But of course, some people might enter into the centralized quarantine points. Of course, the quarantine days have been shortened from 7 plus 3 to 5 plus 3, meaning 5 days of centralized quarantine and 3 days of stay-at-home isolation. When they stay in the designated quarantine places, there may be some regular medical needs that requires the isolation stations to have a clear knowledge about those medical needs from the isolated personnel. They must know the health status of the isolated people. For example, if they have some underlying diseases, on a daily health monitoring basis, in addition to checking their temperature, having nucleic acid tests, they must also learn the discomforts physically and then make certain medical arrangements. And then we can avoid worsening those mild diseases. If they turn to severe symptoms, then the difficulty of treatment will be only higher. So that's about the 5 scenarios of our medical services. We must pay instant attention to the 5 scenarios and have certain arrangements in place so that even during the pandemic period, we could effectively ensure the general public's basic medical needs of treatment and medications. Thank you. Next question.
谢谢南方都市报记者。优化防控的这20条措施和第9版防控方案之间的关系是怎么样的？
What's the relationship of the optimized 20 measures with the version 9? And does that mean that the version 9 guideline will be suspended in implementation from Southern Urban Daily? Thank you for the questions. In the past 3 years, at national level, there have been 9 versions of guidelines. You may remember all of them. The first guideline came out on September previous year. The third one came out in May 2022. Version 6 came out on March the 7th. Version 7 came out on September the 11th, 2020. Version 8 came out in May 2021, and version 9 came out on June the 28th, 2022. I mentioned the dates of the promulgation of each guideline because each guideline is based on the overall containment strategy. We have never stopped this pace. And we take customized measures at different time periods. So we keep adjusting those guidelines dynamically because the virus is varied. And based on our understanding of this pandemic, we keep adjusting our measures. Those guidelines, after being updated, are becoming only more scientific and precise. Every guideline has considered the incubation period, transmissibility, and other epidemiology results, as well as the international pandemic situation. By organizing the experience we accumulated and combining with our national containment strategy and targets, we've done a series of studies with the wisdom of experts from all walks of life. It's been testified that every guideline has been tested by the time, and the achievements are visible. It's the same thing with the 20 optimized measures. As I have introduced, we have experimented and re-evaluated before making the final adjustment. From version 1 to version 6, they basically targeted at the original virus. Version 7 targeted at virus Alpha, and version 8 targeted at Delta, and version 9 targeted at Omicron since January the 8th, when Omicron entered into China. Of course, Omicron varied as well from BA.1 to BA.2 to BAF7 right now. It keeps evolving. But still, they are all called variants of Omicron virus. Omicron virus was firstly found last year on the same day as today. That is November the 11th, 2021, and it's been 1 year. There have been over 400 variants of Omicron in the past 1 year's time. It keeps changing. But I have to say that those variation belongs to quantitative change. The incubation period has been shortened significantly. It's less than 3 days incubation time, and the symptoms are usually mild. Those variants lead to low ratio of severe symptoms, and the fatality ratio is also lower. Now, since it's the winter time, the influenza is another risky point. That's why, since July and August, we did another round of re-evaluation of version 9 guideline. We already had 4 months practices of version 9 guideline, and then we decided to optimize the measures in version 9 guideline. In addition to the 20 optimized measures, all the remaining measures in the guideline version 9 will be sustained. With the reduction of the isolation days from 7+3 to 5+3, such measures are highlights. To give you one example, we canceled the intermediate risky place identification. The containment measures in the high risky places remain the same. They cannot go out of their doorsteps. So that remains the same. I have to emphasize that we only optimize the guideline version 9. If the measures in guideline version 9 do not need to be optimized, then we didn't mention the change. They will remain the same. Our containment practices prove that version 9 guideline is effective and scientific. The 20 optimized measures are only the updates and optimization of version 9 guideline. All the other remaining measures in guideline version 9 must be implemented to the full. I have to emphasize that strictly preventing and controlling the pandemic must walk side by side with the optimized 20 measures. We must give equal importance to the two. Why? The regular prevention and control is the precondition of optimization, while the optimization measures are the key tools to better prevent and control the virus. So we must work on the two equally. With the 20 optimized measures, we cannot drop our vigilance on the strict prevention and control measures. And because of the strict prevention and control, we cannot tolerate the one-size-fits-all policy towards the 20 optimized measures or simplification of the 20 optimized measures. Otherwise, no matter how optimized the containment measures are, we cannot generate any good effect. Next question.
谢谢香港中评社记者提问。我们注意到此次防控措施的优化，将多处集中隔离的要求进行了调整。
In the optimization measures, there have been several readjustments as to the centralized isolation. Does it mean that the necessity of the centralized isolation is getting lower? Is it possible to cancel the requirement of centralized isolation in the future? From China Review News. Thank you for your questions. The COVID-19 is a brand new contagious disease. WHO claim it as a public event, public health event, and it's not ended yet. For such emerging infectious disease, we have to look at its harm. Especially, we have the centralized isolation of the close contacts of the positive cases. That's
在
an
我们
important
整个
means
的
to
这
cut
个
off the
近3年
transmission.
抗疫的工作实践中发挥了非常重要的作用。
In our past 3
当然
years
这
of
次我们20
containment
条这个优
practices,
化措施
such a
呢，
policy
对于
has
密
played a
接
big role.
对于这个
In the
高风
20
险区
optimized
域溢出
measures,
的外溢的人员，以及结束闭环
as
就业的高风
to
险岗
the
位从
people
业
coming
人
out
员
of
它
the risky
缩短了这
people
个集中隔
and
离
the
的期
personnel
限，或
working
者是
in
由
risky
之前的集
posts,
中
we
隔
have
离调整
shortened
为这个
the
居家
isolation
的
days.
隔离或者健康监测。
Or
那么这样的调整是基于
readjust
对于
the
这个
isolation
病毒
places.
它的新的这个特
Such
点和以
readaptation
及我们
measures
前期刚才
are
常局一下
taken
前
based
强
on
强
the
调，
features
我
of the
们是边
variants.
防控
As
边研究
Mr. Chang has
边总
mentioned,
结边优化。
we
所以呢是在
have
这
been
样的一
studying
些
and
基于数据
organizing
基于证据的基础上做的优化，
along with
并不
our
是说这
implementation
个
of
集中隔离
containment
的这个
measures.
措施它的这个
Such
必要性在降低。
optimization is
所以当然未来
evidence-based.
随着我们这个病毒
It
的不断
doesn't
变异
mean
对这个
the
疾病的
necessity
认识
of
的
a
不断
centralized
的
isolation is
深
getting
入，
lower.
以及整个国际的
With
国际化
our
的疫情
better
形势的一个
understanding
变化，
of
我
this
们也会不
disease
排除就是
and
再
with the
对我们的
evolvement
国家
of
的这个
international
隔离措
pandemic
施呢进
situation,
行进一步的一个优
we
化调整。
cannot say
好，谢谢。
definitely that there will be
好，谢谢。
no
请继续提
optimization
问。
in the future as to
好，那
isolation
请
measures.
右侧区第2排第
Next
3位
question.
穿黑色衣服的女记者。
谢谢发言人。向京一导报记者提问：我们注意到20条措施当中，包括加强医疗资源建设，做好住院床位
We
和
noticed
重症
that
床位准备，
as to
增
the
加
medical
物质资源
resource
加快相关
development
药物
and the
和医
beds
疗设备
preparation
准
for
备
the
等。
severe
请问这些措
diseases,
施是否
the
意味
addition
着
of
不久的将
medications
来会
and
全
medical
面放开？
equipment?
要全面放开，还
Do
是要
those
做哪
measures
些
mean in the
更充
future
分的
we
准备？
may
谢谢。
好，请
totally
北海
loosen
朝鲜
the
来回答
containment
这个问题。
measures in the future? From Hong Kong
好，谢
Economic
谢这位
Herald,
朋友的
Mr. Lei 海
这个
Chao.
问题。刚才我已经提到了，我们国家呢是一个拥有14亿人口的大国，并且呢老龄人口众
Just
多，
now, I already
需
mentioned
要关
that
心
China
关爱和
boasts
脆弱人
1.4
群的
billion
基数
population with
也
large
比较大。
proportion of elderly people, and the
我们国
base
家呢
number
又面临着
of the
发展
vulnerable
不充
population
分
is also
也
big.
不均衡的问题。
China is confronted
地
with
区
the
之间
issues like
城乡之
imbalance
间
and
差异比较大。
insufficient
就医疗
development,
卫生服务的
and
资
big
源来
difference
看，
across regions
我
and
们总
between
量
urban
上
and
也
rural
是
areas.
相对不足的。
As to the
目前
medical
我们
resources,
国
the
家的医疗
absolute
床
number
位
is
经过这几年
insufficient
的
as well.
这个有序发展，每千人口的医疗床位呢，
After years of development,
6.7张，
now per 1,000
每10万人
patients,
口
the
的
beds
重
are
症医疗床位
6.7
才
per
不到4张。
100,000 patients
这个
with
指标啊
severe
与
symptoms.
发达国
The
家
total
之
beds
间
supply
还是有
stands
不
at
少
less than
明显
4.
的差距的。
Those numbers
这就是我们的
are
国
backward
情，
compared
也
to
是
the
卫生
developed
方面的
nations.
实际
That's
情况。
our national condition. And
所以在
it's
应对
real condition in
这个
terms of
新
health.
冠肺炎疫情的过程当中，
So,
我们一
in
直强调
response to
要加强
COVID-19,
能力建设，
we
要加
keep
强各方面
emphasizing
的
that we
资
need
源储备，
capacity
包
building
括人力、
and resource preparation in all fields, including manpower, beds,
这是一个综
medications,
合性
and
的这个
vaccines.
防控安排。那么目的呢，就是要
It's a
统筹好
comprehensive
防控
arrangement.
和日常
The
的
goal
医疗
is
服
to
务保障之间的
coordinate
关系。
between pandemic
另外，我们在
control
定点医
and
院的建
daily
设，在
medical
亚定点医院的
services.
建设，
As to
还有
our
在
development
方
of
舱医院的建
designated
设方面，
hospitals
我们都做出了
and
一系列
makeshift
的规划，
hospitals,
也提出了一系列的，
we also
设置要
have
求。
certain plans
比如说我们在
and
今年6月
requirements.
份，
For example,
那么专门提出了
in
应
June
对奥密克
2022,
戎较大
we
规模疫情
especially proposed
怎么
that in
办的
response
若干
to
措
the
施。
large
今
scale
天我们
of
讲
Omicron
20条，
transmission,
那么我们在
what
6月份，
measures can be
刚才我
taken?
们希洛同志已经提到了，第9版的防控方案就是
Zilo
今
just
年
now
6月8
mentioned
号
that
推出
in
来，
June this year,
其中有一个背景呢，也是
we
基于我们对
introduced
奥密克
version 9
戎
guideline.
较大规模防控
One
的实
reason
践新的认识。
was because of
所以加
the
强能力
new
建设呢，既
understanding
是
of
我们
Omicron
高质量
virus.
发展医疗卫生事业的
So
需要，
capacity building
也
is
是
a continuous
疫
task.
情防
It's
控
necessary
过程
for
当中
high quality
医疗
development
救
of
治
the
的需要。
medical sector and the basic necessity of medical treatment while responding to the pandemic. Of course, with our joint efforts, especially regarding to prevention of the infection, that priority was decided by the working style in this new era of the CPC. Prevention was given the top priority. That was clearly stated by the CPC's working style. So we have to try our best to minimize the number of infections and minimize the number of severe diseases or dangerous diseases. As to people suffering from underlying diseases, especially the elderly people, we will try our best to minimize the mortality ratio. All of those are comprehensive measures based on giving top priority to prevention. It relies on different pillars. It's not just the achievement of one place, all of one time. Personally, I deeply feel that the achievements in all localities of pandemic control are thanks to the leadership of the CPC and our socialist system that allows for mobilizing resources to do a big thing. You shouldn't mistake that Omicron is a mild disease right now. If you think that there are so many achievements made, they are only coming because of the efforts taken by the medics. They come in the front line to shoulder the burden for us. For one district or one county with positive cases, we usually take the municipality as the unit to respond to the virus. Sometimes we even mobilize the resources in the whole province to support every place. Sometimes the national government dispatches experts to treat the severe symptoms. So it takes the whole nation to help the affected places to get through the challenges in terms of severe diseases and symptoms. The cases as such cannot be exhausted. In the previous report, we have treated a lot of elderly people with underlying diseases who are on the brink of death. But the life-saving efforts are the reasons behind the successful survival of those vulnerable people. It even takes the joint efforts of the national level experts. So, capacity building and resource preparation and enlarging the team of services are the natural efforts required. Here, I want to say that whether when responding to the infectious diseases or other natural disasters, which may lead to some derivative health challenges, and public health events, they all require the capacity building and preparation of medical resources. Now, if we are able to increase the number of beds and the medical resources to respond to the severe symptoms, we are not just thinking for the COVID-19 prevention and control. Those resources can be utilized when responding to some other emergency public health issues. We must continue to improve our early warning system and give a correct judgment of the risks. And we must build our epidemiology survey capacity. And more importantly, our clinical treatment experience must be improved, especially when it comes to the severe diseases. In addition to version 9 guideline, the national government also published the version 9 treatment plan targeting at clinical treatment, We give play to our advantages to combine Western medicine and traditional Chinese medicine to better respond to the challenges posed by the COVID-19. All in all, we aim to build a suitable containment policy commensurate with the public health situation and national security requirements. In the future, we will continue to make progress in stability. Even with small steps, we never stop the efforts. And in line with the features of the variants and our clinical experience and improvement of our prevention capacity, we will customize and optimize our containment measures continuously so as to safeguard people's life and safety as well as health. We will try our best to coordinate economic development and pandemic containment. Next question.
谢谢主持人。中国日报记者提问：当前已经进入冬季，请问物流的保通保畅工作
From China Daily.
京东明春如何统筹做？
Now it's winter time. How is the situation of logistics insurance? How can you balance the pandemic containment and key supplies guarantee? Han Jinghua will take the question. Ministry of Transportation implement the CPC Central Committee's instructions. The pandemic must be controlled, but economy must be stabilized and development must be safe. We give full play to the Office of the Logistics Guarantee in the State Council. We take the whole nation as one, and across the provinces they work in coordination. We will smooth away the logistics lines and ensure that the transportation insurance can make stage-by-stage achievements and be cemented furthermore. Right now, the transportation network nationwide is smooth, and the transportation logistics work are going on orderly. To stabilize our supply chain and production lines, to better serve our economic and social development, we have enough services in place. Right now, there are some new pandemic cases in China because of the variation of the virus and the seasonal reasons. Our prevention and control situation is only more severe. In the future, the Ministry of Transportation will continue to implement the Standing Committee's spirits on November the 11th to smooth away the logistics transportation, especially the key supplies transportation. We will try to serve people's life and production needs. First of all, we will ensure the smooth network of transportation. We urge and guide different localities to stringently standardize the transportation facilities and adhere to the guideline to lawfully implement the measures. The hubs must be kept in normal operation, and the terminal stations must be orderly operating. There will be more scientific analysis of the network of transportation, and we must scientifically manage the trucks. And there must be 24/7 services on post. The hotline must be in service. As to truck drivers, logistics companies who may complain about unsmooth transportation, we must respond immediately and correct the wrongdoings to ensure the transportation network is smooth and the supplies logistics is smooth, especially when it comes to the terminal station. Secondly, for the key supplies, they must be insured. The supply chain enterprises must be pulled in the white list. There must be centralized organization and dispatching. For the vehicles carrying key materials, they must be given the green channel, green pathway, and they can cross the gateways and be anchored in a prioritized manner. In the key transportation hubs, it must be smooth. There must be quick loading and unloading. The railway and airway must be smoothed as well, especially in the terminal points. We guide the localities to have some transfer stations. For the affected places, the key supplies must be safely and orderly transferred to ensure that medical people's livelihood, foreign investment, and other relevant materials can be safely and efficiently transported. Thirdly, the regular mechanisms must be in place. We guide localities to implement the system of transportation guarantee. There must be some implementation as to the temporary measures of monitoring the transportation situation. For the key hubs and channels and regions, there must be real-time monitoring. We will optimize our mechanism to ensure our guarantee work and our emergency response capacity. We will work hard to guarantee safe and reliable transportation system. Fourthly, pandemic control in the transportation lines. We will execute the State Council's 20 optimized measures and never slack in implementing the transportation-related pandemic control. We will optimize our measures as well for the posts with high risks. In the closed loops, we will take more targeted measures of containment. We urge the companies in logistics, the parks, ports, piers, railway stations, airports, the mail stations, and other places, as well as the personnel working in those places, to strictly implement the pandemic containment measures. There must be stringent implementation of the nucleic acid test upon arrival to cut off the transmission in the transportation lines. Next question. From the 21st century economic, to implement the 20 optimized measures, how will you guide the localities to optimize their implementation in the commercial sector? Ministry of Commerce will also implement the central government's instructions to guide the local commercial bureaus. We will optimize and detailize those measures to coordinate pandemic containment and commercial development. First of all, in the commercial sector, there will be stringent containment measures. We guide local authorities to adhere to the version 9 guideline and the 20 optimized measures, as well as a series of technical guidelines in the commercial sector. For example, in the agriculture wholesale markets, shopping malls, supermarkets, the catering businesses, and some other key places, there must be tough measures taken to contain the pandemic, and we must scientifically and precisely implement those measures. We cannot willfully expand the scope of nucleic acid tests, especially those wholesale markets responsible for emergency supplies. We will guide industrial associations to optimize the commercial sector, exhibition sector's containment measures. We will better publicize those new measures. Secondly, in the development zones, we must urge the development zones to establish an accountability system to implement those optimized measures. With that accountability system, there will be a log to manage the pandemic containment issue. For the key posts and key personnel, there must be some basic supplies like the shift system and the basic life guarantee. We must ensure logistics services during the pandemic period. As to the key enterprises responsible for guaranteeing the basic necessities, they cannot be closed down. And as to the foreign invested services, we guide different localities to give play to foreign investment. With the dragon-head foreign invested companies, there must be smooth communication to get a clear knowledge about the pandemic situation and respond to the problems immediately. For the key production plants or warehousing, places, there must be better services to ensure stable production lines and supply chains. With the foreign invested companies and their commercial associations, there must be regular communication so that the enterprises can have an instant knowledge about the updates of the policies of containment. Fourthly, in the field of foreign trade, there must also be production and logistics services. There will be a wide list of the prioritized enterprises. We will organize our available experience to detailize the closed-loop management procedure and working mechanisms so that the production will not be suspended and transportation will be guaranteed, and the business people's interaction will be ensured in the transportation hubs like the piers. There will be standardized procedure. We will improve the efficiency of the transfer of goods so that the imports goods could come in and out very quickly. As to cold chain companies, they must hold themselves accountable for safety so that we can cut off the transmission from the source. And that will pave the way for the imports of the cold chain products. As to export, we must also smooth the way they export. For those that should be exported, they must be guaranteed. We must guarantee the production and the contract liability. Our products must be able to make the way out, and foreign trade must be facilitated. Thank you. Today we receive a lot of questions, but in the interest of time, we allow for only last 2 questions.
好，谢谢发言人。东方卫视记者提问。本次措施优化强调，全员核酸只在疫情底数不轻的时候
The Dragon Television.
要求纠正1天2检甚至1天3检等不科学的做法。
It is raised that the wrongdoings must be corrected, such as there must be 2 nucleic acid tests per 1 day. So is that in contradiction to the regular nucleic acid test policy, and should we replace nucleic acid test with antigen test? Madam Wang.
作为新冠疫情处置的第一个关键的要素，就是要做到这个早发现，所以监测预警是非常重要的。
of responding to the pandemic is early discovery, so monitoring is paramount. In the version 9 guideline, we clarified the requirements of regular nucleic acid tests. People, environment, and objects must be monitored together, including the monitoring of the medics, risky population, key places and institutions, community, management personnel, and medical institutions, imported products, environment, drugs, and the virus genes. It's 8-pronged. Since 2020, we have taken a lot of measures to tackle the virus. So we accumulate those experiences to guide different localities to have early discovery. Our system is quite sensitive. Once a case is found locally, to have regional nucleic acid test. According to the version 9 guideline, once the pandemic breaks out based on epidemiology, if we have discovered a very clear chain of transmission and there is no further transmission in the communities, there is no need of all mass nucleic acid test. You only need to do the test in the risky population and risky places to have quick response. If the positive case is discovered late, and with our genetics study, there are multiple transmission channels involving large number of people on mobility. Then we must do our study first before taking the large scale of nucleic acid test. So in the provincial capitals, countrysides, big metropolises, there are different requirements as to the time points of having such a regional nucleic acid test and the termination of the tests. So the core of nucleic acid test is quick epidemiology. With the region-wide nucleic acid test, we can have comprehensive study and judgment that will minimize the influence of the pandemic over our economy, people's daily lives, and that can help to ensure people's life, safety, and basic health. As Mr. Lei mentioned, people come first. So, in guideline number 9, be it the regular nucleic acid test or the nucleic acid test, once the pandemic breaks out, we have very detailed requirements. Of course, in the 20 optimized measures, Article number 6 is for the places with no case, they must take nucleic acid test on the risky population and do not scale up the coverage of nucleic acid test. So those two are consistent. They do not contradict each other. The 20 optimized measures are based on version 9 guideline. It's a further reaffirmation of version 9 guideline in terms of nucleic acid test. And it also aims to correct the wrongdoings, such as 2 tests per day. Last question.
谢谢中新社记者提问，想问一下我国新冠病毒疫苗的接种情况如何？加强免疫的接种情况是怎么样的
China News Service, what is the vaccination situation, especially booster, among the elderly population above 60 years old? In the latest presser, it said that the overall vaccination ratio and the booster vaccination ratio among the people above 80 years old are yet to be improved. What is the latest data? And how to improve the coverage of vaccination among the elderly people? Mr. Chang Qile. Just now, I mentioned in the 20 optimized measures that those measures are introduced based on our actual efforts and the features of the variants. So it's an evidence-based scientific optimization. We observe the principle of life coming first and people-orientedness. We will orderly encourage vaccination, especially among the elderly population. The vaccination is commonly seen as an effective means. But compared to the other vaccines, like the vaccines to treat measles and smallpoxes, the vaccines to tackle the COVID-19 may not prove very efficient because, for example, once the vaccines to treat the smallpox came out, smallpox vanished completely from this earth. But I still have to say that in terms of preventing severe symptoms and death cases, the vaccine to tackle the COVID-19 is still very efficient. To prevent death and severe diseases, it's very effective. Why is that? Because less symptomatic carriers change to severe patients. Because of the vaccine. You may have noticed that in Western countries, after they have completely lifted their restrictions, but still, the infection rate is not 100%. That means, once vaccinated, the vaccination plays a big role in preventing the dissemination of the infectious disease. As you may remember, we introduced the vaccination since December the 15th, 2020. Until yesterday, the total vaccination stand at 1.34 billion population. For those population completing all doses, the number is 1.27 billion. The coverage ratio is about 92.5% of the total population. And 90.29% of our population have completed all doses. For elderly people above 60%, 239 million have been vaccinated. 228 million elderly people have completed all doses. The coverage ratios are 90.65% and 86.38% of all the elderly people above 60 years old. And 180 million elderly people above 60 years old have received the boosters. As to the age group above 80 years old, as the reporter has mentioned, the vaccination ratio with all doses covered is only 65.7% of the total number of people. Only 40% of the elderly people above 80 years old have received the boosters. Based on the statistics from Hong Kong in the first half of 2022, among the death cases, over 96% of the death cases belong to the age group of above 60 years old. 70% of the death cases belong to the age group of above 80 years old. That is to say, based on the latest 2 years experience and judging by the effects of vaccination, it helps to reduce the ratio of death tolls and severe symptoms. And if we look at the number of vaccination, we still have some room of improvement, especially among the age group above 80 years old. And the elderly people are the most in need of vaccination. So, to improve the vaccination with all doses covered, especially the boosters, it's a necessary cause and an urgent matter. Here, we call upon the elderly people to get vaccinated and do not believe the rumors on the websites about the vaccines. Especially, it's important to have the boosters injected, because it's better than none. In the next step, according to the Joint Prevention and Control Mechanisms arrangement, we will make out the plan of vaccination to guide localities to have diversified and people-friendly services so as to facilitate the vaccination. Be it the vaccines of COVID-19 or the other vaccines, we have good organization and good experience. There will be a lot of follow-up services after vaccination. So, do not have worries when you get the vaccines. But please keep in contact and give full information to the medical people responsible for vaccination. We are trying to lay out the vaccination plan, and we will publish it once it comes out. Thank you. In today's presser, experts from different authorities have briefed us on the optimization of the containment measures. Thank you everyone for your participation. There will be other pressers to follow. Please pay attention. And this is the end of today's presser. Thank you for watching.